As a medical profession, what is your advice on what someone with epilepsy can do if they're low on prescriptions?
So if there's someone out there that's getting low on their prescriptions, the first thing I always recommend is that they call their pharmacy. Pharmacists have a lot of ability to either provide a refill even if your prescription has expired, or if the refill is due and they don't have any refills left. So sometimes they can do that automatically. And sometimes what the pharmacy would do would be to send a continuing care request form to the physician. Our offices we still have lots of staff there doing the work that needs to be done. So we're responding to our phone messages and faxes on a daily basis. So we can do that without obviously having to see the patient in person. So the first point of contact would be your pharmacy. If the pharmacy needs something further, they or the patient or their family can contact their neurologist contact directly, and that will get answered. Good. Pharmacies have also had to only give a 1-month prescription for medications, even if we had it written as please provide a 3-month supply or a 2-month supply or something like that. So that's something they've had to do. As a result, you may be faced with increased dispensing fees. So please talk with your pharmacy about whether or not they're waiving those fees, or if there's something that can be done to help out with that. If you're still struggling, please contact your healthcare provider, leave a message, and we'll see what we can do to help with that as well. There's no way around doing the only 1 month at a time right now. That's kind of mandated, but some pharmacies may be able to waive those extra dispensing fees.
What would be the best point of action to do if you need to speak with your doctor?
So I encourage families to continue to call. So for pediatric patients, families would call their neurologist offices directly. If they don't know what that extension is, just call the hospital switchboard, and they will put them through to the neurologist office. You won't get a live person. You will have to leave a voicemail, but those voicemails are checked every single day, and the information is passed along either to the nurse or the neurologist, so that they can address it themselves. So it's not the same. You're not going to kind of always get the person you want to speak to at the other end of the phone, either the admins, the physicians, or the nurses. But one way or another, we will be able to get back to you.
If you'd like to touch just a bit on the importance of getting enough sleep, enough exercise, healthy living routines.
So it's still important during the pandemic for people living with epilepsy to continue to get, as much sleep and healthy exercise as they can, respecting, of course, the rules around social distancing. It can be very challenging to try and get a continuous or regular routine when you're not able to see your friends, your family as much, and maybe you've not even be able to go to work. So it is important that you sort of set up a little schedule for yourself every day. So get up at a regular time. Try not to sleep in every day. Try not to stay up late. Try to keep to your regular routine as if you were going to do what you would have normally done in the daytime. That also helps to cut down on getting headaches, and it maintains a better schedule for your body, especially even with eating as well. So have your regular meals, breakfast, lunch, supper, snacks. It's very important that you continue to have some kind of a regular routine for your body. It is very healthy. If you can't get outside, if you live in an apartment, walk around your apartment. Have something set every day that you do, a little yoga, a little exercise routine that's appropriate for yourself. There's lots of videos available on YouTube that you can go by. Even a few minutes every day can make a difference. So continue to do that.
What is some advice you can give to other parents on how to keep their kids active and not be stuck inside all the time, and keep them entertained?
Definitely, it's really a struggle for all parents to help their kids adjust to the isolation that comes with this pandemic. It's really, really difficult on all family members. With young kids, it's really hard because they don't really understand why they can't see their friends and go to daycare and go to school. And it's hard. Some people don't even have access to internet. So, just FaceTiming or Zooming or finding a way to see your friends or your family's faces can be almost impossible. And sometimes they don't want to. So some kids, with their friend groups and whatnot, they may not even want to call them on the phone and chat, let alone see their faces. It's too hard. So they miss them like crazy, but hearing their voice and seeing their face, sometimes it makes them miss them even more and can make them even sadder. So if you're trying to encourage your children to connect with their friends, or and they give you some resistance on that, so just listen to that. Don't force that. Let them say, no, I don't think I want to go on a FaceTime or anything with my friend right now. There's a reason for it, and what I've learned is that can be a little bit too hard. So spending lots of time together is really important. If they feel that they're going to get even sadder if they try and connect with their friends, then as a family unit, keep connecting, finding new things to do together, either a new craft or a new hobby, drawing, making something. Baking has become a big one for people as well. Trying to do some DIY things, because there's not a lot of money going around either, especially if you're not working, to go out and buy extra groceries to go baking. So being a little creative in working with the things that you already have in your home is just some easy, practical ideas for families to follow with their kids. But if they're giving you some resistance with connecting with friends, just be sensitive to it and listen to it, and just move on to something different. It can be very stressful, as you're all experiencing, being at home during the pandemic and having a lot of media attention paid to not only the pandemic, but other tragic events that have happened recently in the province. It's really important to be aware of who's around when you're listening to the news, when you're checking out social media, to limit that and be careful of what you're saying. There are resources out there on some of the healthcare websites and the government websites, and Dr. Strang himself has even posted how to talk to your child about a tragic situation. So try to access those resources, and just try and limit the amount of exposure that children have and that your whole family has to this. You can't listen to it all day, every day. It's draining emotionally and mentally.
A lot of people and kids are worried about COVID and with their epilepsy. What advice can you give to them?
So having epilepsy, you're going to be worried every time you get sick. Is this going to lower my threshold? Am I going to have more seizures than I normally do? And what can I do about that? Well, prevention is key, just like prevention for everyone else. Wash your hands more often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer. And do that more frequently. If you're like, I don't remember last time I washed my hands, it's time to wash your hands again, just for no reason. And of course, it's really important to wash your hands well after using the washroom. If you've touched something like your face or your nose, if you've had to blow your nose or cough or something, make sure you always wash your hands after that. Try not to touch your face as much as possible. Just try not to do that. Cough or sneeze into your sleeve as much as you can. Try to remember that as well. Cleaning the surfaces in your house is really important. So a few times a day with a household cleaner, go and wash all the countertops, tabletops, your light switches, your doorknobs. In the kitchen, I go through and all of my appliances get washed, the stove and the stove knobs and the microwave and whatnot. So make sure to do all of that. keep your toothbrushes separate. So if there's 3 or 4 people and you only have one bathroom, keep a separate container for all your toothbrushes so that they're not touching each other. In the washroom, when you're done, wipe down the counter, the faucets, the doorknob, the light switch, the things that you've touched in the bathroom with a household cleaner, and then make sure to wash your hands properly as well. Those are the best things you can do. Follow the rules for social distancing. Don't go out if you don't have to. If you have to go out, wear the homemade masks that they're suggesting to wear if you feel you're going to come into contact with someone less than 6 feet from you. If you have to go out to get supplies and groceries and whatnot, make sure to do that at one place and just once a week and just one person. If you can take advantage of an online order to do a curbside pickup, again, that's ideal as well. So just be vigilant, stay home, stay safe. It's getting old, I know, but it's working, and we're really getting there, but we can't give up yet.
Who would, in your opinion, would be best to call if you need help with mental health or to talk to somebody?
Number one, it's important to recognize that don't keep yourself in isolation. If you're feeling stressed or anxious or depressed and isolated, please reach out to someone. Even just to say, can you make sure you check in on me once a day or once a week? Just give me a call and check in on me. Use your supports that you have. Use your family, use your friends, use the Epilepsy Association. Make sure to do that and reach out. It's also important to don't forget the strategies that you normally use if you find yourself in a situation where you are getting more anxious or you feel that you may be getting depressed or isolated. Use those resources and the strategies that you've always used. Those are still there, and now is when you need to put them into play. If there's someone that you've normally connected with, a healthcare professional or a counselor, reach out. Sometimes they still can connect with you by phone or email. So those would be the things that I would suggest to start with. If at any time you feel that you are in crisis and that you need help now, obviously using the emergency services for any emergency, mental health or physical emergencies, our emergency rooms are still open. We're still there, and we're safe. We're safe to come to. We don't want people staying home for an emergency. If it was an emergency 3 months ago, it's still an emergency. So please don't hesitate to call 911 or go to the emergency room when it's an emergency. They are set up with their their protective equipment to protect themselves, to protect you. So please don't hesitate to do that.
I feel stronger than before.